Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arno, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area. Welcome, everyone, to the Taking Good Care show. It's another episode of TGC. I'm just going to start using the 3 letters because I think it's about time. And today we have a very special guest. It's our second guest, and Dave and I are so excited to have Dr. Holly Whyte with us on the podcast. Holly is a great friend of ours. We all went to grad school together. We did our PhDs. We went through the ups and downs of being in a rigorous program. And I'm just glad that we have our guests and friends on here because I do like to think that our PhD cohort, we were a really tight group. And I'm just so glad that after like 15 years later, or whatever it is, like we're still talking, we're still smiling. And so it's amazing to have Holly here with us today. So Dr. Holly Whyte is a doctoral level psychologist with 15 years of experience committed to delivering ethical and effective therapeutic care through diverse evidence-based treatment modalities. Her practice is based in Edmonton, Alberta. Throughout Dr. Whyte's career, she has embarked into various roles, including teaching, serving as a sessional instructor at universities, and supervising other clinicians. Apart from her extensive experience providing treatment for trauma using modalities such as prolonged exposure, EMDR, and cognitive processing therapy, Dr. Holly Whyte is also a highly trained Gottman method therapist, and she provides couples therapy and has specialized training in treating trauma, affairs, and addictions in couples. You can find Dr. Whyte at her private practice in Edmonton at yeg-psychology.com, on Facebook at YEG Psychology, and on Instagram at yeg.psychology. Outside of her professional life, Dr. Whyte is a married mother of 2 young children and enjoys activities such as touch football, curling, golf, and running. Welcome, Dr. Holly Whyte.
Thank you, Andrew and Dave. I'm very excited to be here. And honestly, I completely agree. It's so nice to have these relationships maintained after 15 years and to see how we've evolved into such wonderful professionals. So thank you for having me. I appreciate it.
Well, yeah, I'm so happy you're here, and I've been looking forward to this topic since we started recording. So I am just eager to hear kind of how you work in this area and just the wisdom that you have based on the experience that you've had in this area. So can you tell us a little bit about your work with couples or how you got interested in it, or, take it anywhere you want right off the top?
Okay. Well, I think it all stems from like what Andrew was saying earlier is like way back in the day when we did our couples and families course, we got that first exposure to couples. And I really did enjoy having 2 people in the room. I loved the energy that couples bring. And so starting to dabble in that just kind of piqued my interest. But then kind of through training, I didn't get as much opportunities to work in couples. And then I worked at a rehab setting with trauma, and found that there was a lot of like relationship issues that come up when we were with the individual in the room with trauma. So I started just seeing one-off sessions with the person who was in my room and their partner, and I just caught that bug. So I thought, you know what, I want to do more training on this because I don't feel like I'm as competent as I could be. And then I did the Gottman level 1 and level 2 training, and I like absolutely fell in love with that. And then when we went into private practice, I went fully into like couples. That's like, I see a lot of individuals, but I think if I had a pure couples caseload, I would be okay with that too. So I kept going. I also did my level 3 training with Gottman. And now I'm actually working on doing my certification right now, which means I'm getting my own consultation and want to eventually be able to train other psychologists to learn how to do couples. So, yeah, love it.
That's amazing. And I can feel your enthusiasm
Mhm.
for couples counseling. And we're definitely going to talk more about Gottman and Gottman's method. I do think, though, and going back to our training back in the program, I don't do any couples counseling now. I sometimes wish I did, but that training was so valuable in terms of knowing how to work with individuals using strategies, even with couples that you can bring in into individual sessions. So it's so cool to know that both you and Dave do a lot of couples counseling. I wish I did, but this province limits us so much in Ontario. That's another discussion for another day. But Holly, for I'm hearing that you are trained in the Gottman method, and I'm just wondering if you can tell us a little bit more about what that method is.
Well, first of all, like John and Julie Gottman, they're psychologists who were the ones who developed the program. They're actually married, which is really cool. And I loved that it's founded in like research. There's like already over 4 decades of research. And they looked at couples, like over 3,000 couples, and they put them in, and I love this idea. They put them in, they called them the love labs, which were basically apartments that were like mic'd up, videoed, everything. They could watch all the couples doing their daily life, and we're recording all these interesting findings about like what makes marriages successful. And I was really drawn to that approach because all couples are unique. Absolutely. They all have their own strengths. They all have their own challenges, but we see some commonalities amongst it. And I love that they give, with the Gottman approach, it gives very tangible strategies, skills, because a lot of times when couples are coming in originally, they're looking for something to do or practice or try. So I really love that that was the approachable piece for couples counseling. And again, I like the research, and it gives a structured way that the sessions go. So to start, there's always like a 3-session assessment. And I love that, like the first one, I see the couple together and I've got a series of questions that I follow. And it really is nice to see the couple's dynamic. So for Gottman, like I said, we ask questions like, well, kind of what brought you here? Telling me about how you guys met, or like your transition to being parents and all that stuff. So I love that for Gottman. And then what I also like is we go into individual sessions in the next session 2. Each person gets their own time with me so I can find out more about them. Because I know, and I tell my couples, like, I want to know you as a couple, but I want to know you as an individual, because that so much impacts what's coming into the room. If you've like had some kind of trauma in childhood, or if you had some difficulties with a certain parent, or you've had other experiences, that shapes our attachment styles. That shapes our way of communicating or lack of communicating. So I love doing that within the room so I can find out more about each person. And that's what Gottman recommends. And then we do questionnaires. I tell people, like, bear with me. They take like an hour, this Gottman method. And I'm going to ask you about everything pretty much in your relationship, from finances to fighting styles to trust issues. And then we're going to go through it all. So it's really lovely that couples know what to expect with the Gottman method. We know what kind of interventions will be led out of that. We know that it's successful. Like, the Gottman research states, and I love telling clients this data, is like, we can, John Gottman said that he can predict, relationship satisfaction or people staying together with over 90% accuracy. And that gives people a lot of confidence going into the room that, we're guided by certain principles and research that can help support them in their kind of relationship goals. There's way more, but that's just kind of, like you said, the little teaser, a little piece of what it kind of looks like in the room.
Yeah, I'm happy you're kind of walking us through that, because part of the reason we wanted to do this podcast was to connect with listeners who may be thinking about going to therapy, maybe thinking about going to couples therapy. So just, like now it's like, okay, Gottman approach, it's like that. This is what we can expect. I love that, because there are so many people where it's just like this mysterious thing that they don't even know where to start and what to look for. So yeah, I really appreciate you walking us through that model. And I'm also curious, like, when should someone start looking at or inquiring about going to couples counseling?
I'm obviously an advocate for the sooner the better, because so many times like early prevention in couples counseling or even physical practice are helpful. And sometimes it depends on your goals, because I see people in like the premarital counseling type stage. Like we're talking about what to expect when you're married. Or I actually see a lot of people that come before they have a baby, for example. And we're doing things like there's like this thing called bringing home baby. Like we talk about what roles and who's going to do what and the expectations. So you can come early, like before some of these life transitions. And so obviously the things that like we can work on in the room to be preventative, but also I typically see people at different stages after, like I see a lot of people with infidelity or some kind of betrayal. So it can be an affair, or I have like some also clients where there's like alcohol or drugs that's an issue, and that's kind of created some sense of it's broken trust ultimately. So we see you at that piece, or your communication is just breaking down. And a lot of people come with communication issues. I'm like, well, what does that mean? Oftentimes it means that they don't have very good conflict resolution skills, or even, communication during conflict. So we're trying to figure out a way where we can be nicer to each other. So that's kind of what I see is early, sooner the better, but honestly, you can come at any time. It's just like your progress and what it looks like might just be a little bit different for what we're doing.
I'm sure similar to individual therapy, it's you just get all sorts of different histories and stories of people coming into the office. And it's not just about someone who had an affair or communication issues. Now, I do wonder though, Holly, from your experience, do you find that couples counseling is still something that is still a little bit of a taboo topic, or people like as they walk through your door, you might see one partner in the dyad who's maybe a little bit more uncomfortable, not sure what to expect. Maybe they were dragged into it.
Very accurate. That, obviously sometimes it's both parties, but usually there's one person that's more motivated to be there and book the session, and the other one is, slightly mandated to go for the sake of the relationship. And that's not uncommon. It's usually the other partner just doesn't know what to expect, or they felt blindsided that they thought everything was fine. And then they're told to go to couples counseling and they feel like they're doing something wrong, or they're scared that the relationship is in a worse state than it actually is. So there's a little bit of uncertainty and fear. And when that happens, honestly, my goal in that first session is, besides asking the questions, is making them understand the process, feel comfortable. I really try to ally with them a little bit more. Not that I don't relate to the other person, but make them feel comfortable and safe, because I say to all of my couples when they leave, if you want to rebook or not, I don't pressure them. I said, go talk about it, because I have to be a fit for both of you. This isn't just me feeling like it works for one. I have to get both of you. So honestly, I try to make an effort too of really connecting with the opposite gender, because that's one of the fears, is that I'm going to triangulate, or I'm going to relate to the female all the time. And I don't want that to be the case. So I do actually really make an effort of having a good banter. I banter. I have a good little rapport with in heterosexual couples. I should qualify that, that I'm making the male feel comfortable and content with me, and know that I'm actually listening and hearing to their perspective and not just siding with one person or the other.
That brings up a point that I get a lot. And, there's a misconception that you're going to go to therapy, couples counseling, and the therapist is going to tell who's the bad guy or who's the bad person in this, and who's wrong and who's right. And it's almost like you're going to be a referee for us. And so I think that's a really important piece right at the beginning, is to kind of demystify that myth that's not actually the purpose of couples counseling, at least not, the way that I practice and what I'm hearing from you.
A great point, Dave. Absolutely. Sometimes people do want that piece, but it's more about hearing your other partner, and understanding is more what it is. I'm trying to get them not to hear or listen to respond. I want them to truly understand each other's perspective, because when you get why that person is saying certain things or acting a certain way, we can really help go further. So totally, I'm not telling one side or the other, but I will also reiterate, I do have boundaries on what I'm willing to tolerate. So I will actually not necessarily take sides, but if there's any forms of abuse that's happening in that room, or inappropriate levels of criticism or contempt, I am going to redirect that behavior. And it's not that necessarily that's anybody's fault per se, but I want to create the safe space, and I want it to be as effective and kind as possible, because I'm not going to promote this unhealthy behavior, or sometimes it's quite toxic. So yes, I hear both people, but I'm going to interject when there's things that aren't helpful for the relationship.
So, Holly, I'm wondering because I do receive, when I see individuals, I do receive questions about couples counseling. And they'll be like, well, where can I find a couples counselor? Or my partner really wants a male or a
Mm-hmm.
man as a couples counselor because, yeah, he's afraid that if it's a woman, they're just going to side with me, and my partner doesn't want that. So, from what I'm hearing, are you sort of saying that that is a myth in terms of whether the couples counselor is a man or a woman? Like, it's more important to find somebody who really takes into account, that the equity and equality between both partners.
Absolutely. And I think what you're saying too, Andrew, is that it's got to be fit. So regardless of gender, regardless of everything like that, does the way that that person practice fit with you, and do both partners feel okay? And oftentimes the partners that's more hesitant to reach out, maybe they've got to make sure that they're researching somebody that they're comfortable with. So if they want to go to couples counseling and the partner that's hesitating really wants a male, go to a guy, go to a male therapist to get that buy-in and that comfort, if that's going to be better for you. But also I would really encourage, read people's bios, do consults first, because so many of us are happy to do that to see if we are going to be good fits. But we need both parties to basically be on board for it to be effective. If, I'm okay with a little bit of hesitation and having to win people over and explain that. But like I said, ultimately, we're not going to go anywhere if they don't trust what I'm doing, they don't feel like I'm genuine or I'm a good fit. So honestly, I'm saying do your homework, research. And if it doesn't fit after one session or two sessions, go somewhere else. Like, I know I'm not a fit for everybody. Same with reverse for other therapists. Find the fit.
I think that's a great point, Holly, that fit, because if it's not working for the clients,
Mhm.
Trust us when we say this, is that even when you come to our session and we're not a good fit for you, we're probably feeling it on our end too.
Mhm.
That something is just off.
Honestly, so true. And I tell couples, tell them right off the bat, like, I'm not everybody's cup of tea. Like, I am particularly for couples, a very directive therapist. Like, I'm going to tell you what it is. I'm going to be very straightforward. And if you don't want that approach, and that is totally okay. Like, that is fair. I may not be a fit for you, and I can refer you to other people that are a good fit. But a lot of the clients who ultimately seek me out, they can already, like, they're looking for that. They're like, that's exactly what I want. Like, I'm like, I interrupt patterns. I'm going to reframe things. I have been noted to say some pretty crazy things in the room, which actually is why I love couples therapy, and people respond to that. But ultimately, like I said, it is the fit, and it is the therapist also being straightforward on how they work, and if that's going to be in line with the goals of the couple.
Yeah, and I think, Andrew, we talked a little bit about this when we were just talking about therapy in general and going to therapy. Like, I think across the board, for at least our cohort, we've always been pretty open to, like, I'm not going to be for everyone. So find the person that you need to find, and like, I'll help you find that person. And so I really love hearing the way you work, Holly, with Gottman, because that's actually not the way that I work. Like, that's not my go-to for couples therapy. So now I know that if someone's looking for, like, more directive, more kind of like having handouts and worksheets and being able to have a process that's pretty laid out from the beginning, like,
Yep.
those will be that people. I'm more the, like, how's it going? How have you been doing? Like, let's see what's important today. What do you want to focus on? And we negotiate almost session by session. And so it's a lot less structured.
Yep.
And that works really well for some people, and other people not so well. So, there's different ways to do therapy, and there are a lot of effective ways to do therapy, different models. So yeah, just for the listeners, like, don't give up if you tried it once and you're like, oh, that didn't work very well. And the other point that I'd say too, just because this is personal, I'll self-disclose, trying to find my own or our own couples therapist. We used word of mouth, right? We talked to a
Mhm.
couple other
Yep.
couples and they said, we go to this guy and he's really good, or we go to her and she's really good. So it was like narrowed the pool down a little bit.
Absolutely. And honestly, like I said, I have a pretty like full practice. Like I tend to, like I can't really take capacity, but if you get referrals from like Dave or somebody else in the community that you know, you do fit them in because the one you know that they know you. And two, like you just have this soft spot for people that have maybe struggled to find somebody. Like, because actually, even in individual therapy, it actually hurts my heart when I hear that they've tried other people and it hasn't worked. And I don't want them to get discouraged. So I make room for people in order to give them that positive therapy experience because I really don't want people to not come because they didn't find the right fit or it wasn't
Mm.
what they were expecting because there is somebody out there. And honestly, I think another thing that I want to say about therapists is like, you don't hurt my feelings.
Mm.
Like, I think they're worried like they have to stick with you or not. And I'm like, if truly, if we don't jive, it's okay. It really, really is. Like, please, I'd much rather you get better than stay with me if I'm not the right person. Like, and like you mentioned, Dave, we'll find you the referral. So it's truly about you in this process. It's not about me. This is how I work. If it works with you, and of course, I'm going to be able to be flexible in a lot of things, but
Yeah.
if not, go with what your gut tells you.
So, Holly, oftentimes when I am exploring the idea of a client going to couples therapy with their partner, I
Mhm.
get this question like, well, we've been in this rut for so long now. How is a couples therapist or psychologist actually going to help us? So, I guess my question to that is, what is the role of a couples therapist or psychologist within these couples therapy sessions?
Okay, great question. And like I said, Dave might have a different answer because, like I said, he works in it from a different modality. And honestly, I'd like to learn more about that. That's my next goal after the Gottman certification. But what's my role ultimately is, like you said, the word rut. And when I hear rut, I think pattern or a perpetual cycle. So my goal and how I work in the room is to change or interrupt these negative cycles and patterns. One, I'm trying to get you to be more aware of them because sometimes people, it's so automatic. Like we go into this like criticism mode or this almost feels like attacking mode. Then the other person's feeling defensive and either we're perpetuating that or somebody's then shutting down or we're escalating it and it's not getting anywhere. My job is to be able to see what that cycle looks like, let you be more aware of it, and then give you other ways to communicate that or to try certain strategies to understand it more. So I see myself in a role of, I'm almost sometimes a mediator slash teacher, and a way of like, and listening. And one of my favorite interventions to talk about therapists is called the stand wild in the Gottman approach, which I love, is sometimes couples are trying to say something and the other person's not hearing. I get to go in and I speak for them. And it sounds silly, but I get the client's consent, whoever it is, and I say, okay, I want to try speaking for you. Like what I've heard you say, I'm gonna be your voice for your partner. And if I say anything that's inaccurate or misrepresenting, please absolutely correct me. Like I'm not here to misrepresent what you're saying. And that can be so powerful too in the room when I'm like,
Mm.
I'm saying I'm so hurt and this was whatever. And both like, gosh, I'm guessing 90% of the time, both people are crying and they're like, I never heard it that way. So I'm trying to be a third ear in the room to give them that language too that maybe they didn't have before. That's what I see kind of my role as. I'm curious, Dave, what do you see your role as?
I think there's so much overlap. Like I ascribe to this like common factors model that there's a
Yep.
lot of like similar things across different modalities. So when I'm listening to you, I'm like, oh yeah, I do that. I do that in a different way. I often tell couples like, especially if there's a lot of conflict and it'll kind of go through me initially, right? And maybe I'll be asking questions and communicating, and the other partner just gets to sit there and listen and hear their partner talk about something in a way that they weren't able to listen before because they were just in it and they were like thinking about what they were going to say in response. And then after, I'll just ask them like, what was it like listening to that? What did you hear from your partner? And so yeah, initially we're really kind of involved in it. And then, at least for my approach, like, then it's them talking to each other a lot more as therapy goes on. But if they come in and they're already doing that, then that's where we start too, right? Like, I'm just going to sit back and I'm going to go, oh, is this familiar to you? Is this how this normally happens when you're talking at home, or is this different because you're in my office? Like, I'm really curious about, like you said, the patterns that are there. And I think that's the huge difference between individual therapy and couples and family work, is that we are often highlighting a pattern, an interaction, and not so much like you did this and you, like, it's like, how does this work together? And so that's what I love about this work. It's just like, I'm going to hand you this pattern that I'm noticing, and you can tell me if that's off, or if and then sometimes just noticing that they can catch it when they're at home. They're like, oh, we're doing that thing that we do when we're anxious or stressed or angry. But this is not about me. This is about you, Holly. So I'm not going to let you do that
No, but
anymore.
I wanted people to know, because there is more than, like, for couples, like I said, this is my one approach, but like, how does it look with different therapists? So I appreciate what you said. And I love that. I think, honestly, the more I'm trained in Gottman, and I have done readings in EFT, the more I see the same thing as you, Dave. Like, I 100% subscribe to the common factors. That was actually part of my dissertation, is like, there is so many features that are similar. Like, I'm like, oh, it just has a different name or a slightly different way of working at it. Cause like, I do a lot of emotion work. I do a lot of deepening. I'm not really a handouts person. I do homework. I do, but it is so much about analyzing what's going on. And at the beginning stages for me, I'm not interrupting quite yet. Those first weeks of sessions, I'm watching. I'm wanting to see what this looks like, what the dynamic is. Cause, is this they're anxious and they're in my office and this is why it's coming up? Or is this the typical pattern? And obviously, most of the time people are like, oh, this is actually what it looks like. And we're actually better here. And then the more comfortable they get, you're like, okay, this is probably more representative at home. And one of my favorite, which people can't believe, is like, after people come to my office, after they had a big fight, is my favorite time, because I can intervene. Like, they had a big blowout in the car or just at home, and then they came to therapy. I'm like, perfect. Absolutely perfect.
It's in real time, right?
Yes. I love that. I'm like, we can work through this in the moment, rather than like trying to recall what the fight was about, and it's not a big deal anymore and the emotions aren't there. So honestly, bringing those things in the room, like, you don't have to be on your best behavior. Good therapy can happen when you're not in the best place.
Yeah. So I'm holding up right now. I still have this book from our studies, Gottman's 7 Principles for Making Marriage Work. This is probably an old edition now, but I remember reading this book way back when, and he really touts, like, he can predict if a relationship is going to work or isn't going to work. And I know this is going to be a bit of a loaded question, but from your perspective, Holly, and from your clinical experience, what are some of the overarching themes that you see in your practice when it comes to patterns, as you noted, or behaviors where you can see, okay, yep, this is going to work out. It's going to take work, but it's going to turn out well. And conversely, when do you see that, okay, this is going to be very, very challenging, and maybe things will not work out? And I don't know if it's black and white like that, but I'm going to put the question out there and see what your thoughts are as a clinician.
Great that you already alluded to that. Loaded question, because I actually don't feel like I can necessarily predict like which one is going to work or not. Like, I know the research, what's helpful, but I don't know what couples are going to actually buy in and start making the changes necessary. So when you come in, certain couples, actually, they're in a really, really good place. It's more that proactive state. Then of course I can see that being more successful, but I've seen them go either way. However, there are some factors where I'm like, starting to hesitate. So one of the ones is when both partners come in and they're not equally ready to change, or they're equally ready to be in that counseling room. So I kind of alluded to that, like, I need to be a good fit, but sometimes they keep coming and the one person really doesn't want to be there. You can feel that, the other partner can feel that. They're not trying to make the change. They're second guessing everything. They're not taking responsibility. That I'm having a hard time getting any traction with. We may or may not see that being I'm going to air quote successful couples therapy. But the other thing that I also look for, let's say in just a standard couple that's coming, is how many have gotten calls from the 4 horsemen. Basically, what are the 4 communication styles that people are using that are not effective or healthy for the relationship? So one of the ones that he talks about is criticism. How often are we criticizing? And that's like name calling. That's like using like extreme exaggeration statements, like you never do this, you always do this. Like you're criticizing your partner's personality or behavior. And oftentimes it makes the person feel attacked, that sort of thing. If we see a lot of criticism with not the willing to do the intervention, or that we call it the anecdote, like it's called gentle startup. If we're seeing that repeatedly happen, I'm getting a little bit, my spidey senses are going up, or there's a lot of defensiveness. So you're not taking accountability. And I don't believe that everybody's 50-50 in each fight. Sometimes it is more on one person than the other, absolutely. But it's never 100% one and 0 the other. You could have maybe said something a different way, or you could have been attuned in a different sort of way. So are you taking some kind of accountability for what you're bringing into the relationship in the room? And if you're not taking even 5% accountability, then we're going to get stalled pretty quickly. The other biggest one and the most toxic and biggest predictor of divorce is contempt. And when you see contempt in the room, and like before I started, I was like, how am I going to know which one's criticism, which one's contempt? Because contempt is like basically we call it like criticism on crack. Like it's mockery, sarcasm, hostile, eye rolling. You feel it and it feels yucky. As a therapist, to be in the room, you can tell. So that person is acting like superior. It's what you were borderlining like abusive language. Okay. That one, I'm like, and if that's a repeated pattern, I don't like that one.
So is it safe to say that contempt it's felt like that person is actually trying to hurt you?
Mm-hmm. And they're acting like superior to you. They're putting you down. And you're making you feel like you're defective in some way, not necessarily even like your behavior, like, hey, I wish that you were better at loading the dishwasher, but you yourself in some capacity is inferior or not good enough. I don't like it. So and I've been in rooms when there's a lot of contempt happening and you try to reframe it. And that I find is hard for that personality type to take a lot of responsibility for it. Mm-hmm. So that's one that I'm like, not that it can't improve, but is more resistant to the input. And you're nodding your head, Dave. You see that too?
Yeah. And, so this is kind of like an insider thing, but, when I see that, I will kind of take the role of the other partner and maybe challenge that partner and see what the response is like, because I'm going, if this other person is being put down and their perspective isn't being valued in this relationship, at least that's what it looks like from the outside, then how about from me, who's in this like position of authority or like some, I'm in a different role. If I present some information, does that also come towards me, right? Like, am I being belittled or so then it's like, I'm actually trying to model responding in a way. And then I'm looking at the other person, right? And I'm going, oh, like, is this going to be possible? Or is this person maybe at risk of being further hurt in therapy? Right? Because if they're more vulnerable, that actually can be used against them later on, like outside of the therapy room. So I don't know if you want to talk more to that, but that's what comes up for me when there's that contempt, that it's just this like dismissive, almost overpowering. And this is, I'm exaggerating a little bit, but I think it's important to know that, like, of course, divorce rates would be higher when that's part of a relationship, right? And can you recover from that? I think you can, but like you said, both people have to be able to take some responsibility or at least acknowledge that might be problematic.
That was going to be my question, actually. How do you work with contempt then? Like, let's say contempt is in the room and as you talked about earlier, like the pattern of behavior, like if it's been lasting for years, how do we break that cycle?
So the Gottman answer, and I do that, but I also do some other things in the room, is instead of like saying like, you do this, you do that,
Yeah.
It's, can we personalize it? Like, what's
Mm.
your experience? What's your feelings about it? What's your perspective? Because oftentimes, actually, the person who is contemptuous, they do have a lot of stuff going on. They've got a lot of hurt or pain, or there's avoidance because they've had their own trauma. So if we can work on softening, like to use the word softening a lot, is understanding what's going on for you in that moment. So I like to also use immediacy. Sometimes I do some little one-on-one time with that person, like,
Mm.
what's going on for you, or tell me a little bit more. Or because I've done the individual sessions, I can pull out, hey, is this triggering something from when X happened or whatever that's like. So I really try to understand what's behind the contempt. And then that can really create the softening. So if I'm getting to their deeper stuff rather than about their partner, it's almost projecting that onto their partner, and we
Mm.
help that piece. And then, like, exactly like Dave said, sometimes I like to be the other voice of the partner. And I'm not trying to talk for them, but like the other partner, sometimes their demeanor is like they kind of shrink down in their chair, or they have a more emotion. They don't feel like they can speak to it. I said, I take it on myself. I'm feeling really hurt by that statement, or I'm seeing this. I'm wondering if so and so feels the same way. When you say that, I'm getting this reaction. And I can imagine that would be the case. So highlighting, it's not just your partner getting that experience, I'm getting that experience too, and seeing if they're receptive to that. So I'm just honest,
Wow.
like, because you do feel it. I do feel it. I'm like, ooh, that didn't feel very good for me. Did that feel very good for you? So I call it out.
And as you're talking about that, Holly, like I'm getting chills up my spine because it can be such a powerful experience for the person who you may be bringing to that experience. Like you can almost open a Pandora's box, like when you're talking about someone's history. And I'm assuming that they have to be very open to exploring some of those past, perhaps traumas, stories
Mhm.
that are causing that contempt. Do you ever get somebody though who pushes back? Like there's stuff there,
Yeah.
but they're not ready to go there.
So yes, and a little bit no, because usually by the time I get to that point, we have a really good relationship. So that's like when we're getting to address the contempt, because I don't do a ton at the beginning because I want to know a
Mm,
little bit.
got
I
it.
can go there because we have that trusting relationship, and we have that ability to bring those things up. So oftentimes when we do get to that point, they are receptive. And sometimes if they're hesitating, I can be like, okay, I bring it up gently, like, could it be possibly, or maybe I'm wrong, because I don't want to be like, hey, this is because of such and such. So I leave room for the person to respond in that capacity. So the relationship, giving them the room to respond and asking for their feedback has been very helpful. But sometimes people do challenge you in the room. It doesn't happen again a ton, but sometimes it does. Like, how is this effective? Or this doesn't feel helpful, or I feel worse. Those are some of the comments. And so when we talk through that together, and sometimes I feel like I have to kind of defend myself. And if that's the case, I actually am, again, because I'm direct and transparent and saying, like, again, what's going on for you? Or, I feel like I'm having to defend this. What's the block, or what's the barrier? Or again, I'm like, maybe I am not the right fit for you as a therapist. I've said that in the room too to people, like, maybe we're not ready, or maybe it's me. Like, what is it that's maybe creating some of this piece? And honestly, I'm a person that uses a lot of my own guts instincts. And when I'm starting to feel anxious, because as a therapist, I actually get anxiety in the room in certain situations. If I'm feeling like I can feel like I'm getting more anxious and amped up, I'm like, this is a really good indicator that something is not fitting. I'm like, what's happening here that I need
Mhm.
to evaluate? And I'll get through the session, or I'll, call out some things like that makes me even uncomfortable. And then I debrief with other people so I can figure out how to address it better in the future.
I love that, Holly. I love that you're using your own experience in the room with these people, right? And being able to put language to it that maybe they can't. And so it's like, oh, I'm actually feeling kind of nervous or defensive, or like I'm feeling, you might not say attacked, but like I'm feeling like this is happening, and the other person gets to hear those words and go like, oh, I actually feel the same way, but I've never been able to put words to it. So I feel like that again is just a huge value in couples therapy, is that you can kind of sit back and watch your partner
Mhm.
with someone else and see kind of like what that's like, and then be able to take in that information and do something with it. But you were talking, and it brought up for me, like, because we just actually recorded about boundaries and
Mhm.
and like healthy boundaries in relationships. And you said you'll be directive, right? Especially if you see certain things that you need to step in. Essentially, you're setting, a boundary in the room. But I'm curious about that in terms of couples establishing or maintaining healthy boundaries in the relationship and how you might help with that.
So one of them is just in the like giving them the education about what those horsemen were, like the criticism, defensiveness, contempt. And what I didn't talk about was stonewalling, which is basically just checking out. I give them that information first of all of like, these are the boundaries that we got to work, or these are the areas we need to work on. And if these are happening, how do we readdress them in the room? Because I can, at the end, I can very subtly be like, oh, that sounds like a criticism. Or I don't even have to say criticism, like, oh, can we reframe that? So we get that way of that boundary where we're not speaking like that, and they can change it right away. And then I also establish like, if there's certain things that aren't working for people, I do some sessions where I'm like, okay, what's our temporary compromise on the situation? Or what do you need to see changed? Or what's your partner's needs, for example? So we can work on creating that space that's going to be also healthy, not only in the therapy room, but at home as well. Like one of the strategies I love to use for boundaries is called red light. And I tell clients they can call whatever they want, but it's reiterating that you need a break when things are getting overwhelming for you. So if you're in the middle of a conflict or you're having a deep conversation and you're like, I just can't manage, you say red light. And then you actually take a break and you go into another room and you try to decompress for 20 minutes before you come back to that topic. So I really reiterate that idea of like the boundary of you don't just try to like power through your agenda because that's not going anywhere. So my boundaries are like, let's be clear about them. Let's take breaks. If I feel then it's toxic or unhealthy. So if there's a point where, for example, like we have somebody who's in an actively abusive relationship, we know that that's contraindicated for couples counseling. Then you know what, I can't see you at this point in time because, like you said, there's a vulnerable party. It could actually make it worse. So my boundary is if this is happening, you know what, we need to go to individual therapy or we need to do some other treatment option. There's sometimes like with addiction, that might be a boundary. Like, but there's a lot of research, and I did that stuff of how do you work with addiction in the room. But if like somebody's coming to sessions drunk, those are another boundaries for me in the room. But I'm trying to do ways that actually fit for the couple because what my boundaries are may not necessarily also be what the couples are. Yeah. What's going to keep it healthy? Sometimes, honestly, I force breaks and not force. I shouldn't say that, but I may say like in the therapy session, like, we need to take a break. We've had this is a little intense. We have ice packs in our room, or sometimes I'm like, you know what? I need you to get up, go get a drink, go to the bathroom, and then let's come back and readdress it because we're not breaking the cycle. Like I need you to change the space. I need you to breathe for a minute and then we can come back. And so those are some of the things that I do for boundaries that I feel have worked in general with couples.
You're like a classroom teacher for couples.
Sometimes, and honestly, I have a teaching degree like all of us do. So I can relate. Sometimes that teacher self comes out and the parent self as well.
Yeah.
So, yeah.
I think a really good point you bring up, Holly, is like safety, emotional and physical safety are paramount above everything else. So if that's not being addressed in the room, like therapy in and of itself, it's very difficult to move forward. One piece I did want to ask, because I remember going to couples therapy class back in our PhD, and one misconception, which I learned very early on, is like, okay, affairs and infidelity, right? Many people will think, oh, if someone has an affair, that's automatic separation, right? And I learned quickly that that's actually not the case. And I'm wondering, again, based on your experience, what is your concept around working with couples where infidelity has been involved, and how might you work around that? Is it the worst case scenario, and so on?
Great, honestly, great question. And like I said, I remember back in the day, similar things too, being like, I don't think I could ever work with infidelity. Like it's so tricky. And now I shockingly love it, which is so surprising because honestly, it can be so effective. And one of my favorite statements from like not just Gottman, but all the other readings I've done is we think about it in this capacity. Your first marriage is over. That first type of marriage that you had before is over, but we're creating a second marriage that's even better than the first. We're taking the learnings of what contributed to those factors for the affair, the infidelity, and we're trying to resolve them. Because sometimes it's like lack of connection, or there's some other underlying issues, and we can talk about these things that were maybe never talked about before. So there's a lot of optimism. But before we can even get to those pieces, the first thing that I see if we're going to have a successful experience with infidelity is the person who's done the hurting, the betrayer, are they willing to take responsibility for it? Is there remorse? So those are the two things that I need to see. If they're coming in and they're like, well, I had the affair because, and oftentimes like we didn't have enough sex. Those are things that I've heard, or you pushed me to it, then I'm a little bit more hesitant of how this is going to go. And honestly, the likelihood of that bouncing back is tougher. But if the other partner is genuine, like, I'm so sorry I hurt you. I feel so bad. That was my fault. What can I do to build the trust again? Then we have a way better chance of actually moving forward.
Are those two types of statements mutually exclusive, though? Because I can see somebody saying, I'm so sorry. I know I hurt you a lot. However, you did push me to it, or yeah, we didn't have enough sex.
They are separate. I believe personally, because you need to be able to feel bad about what you've done. Because a lot of people are like, oh, sorry, I hurt you. Like you said, but, and like in any sort of statement, whenever you put a but or that caveat, it doesn't work. You do need to take ownership for your part in it. And that's so much of the therapy work is you have to, sometimes they call it like holding vigil. You have to be the one that's saying like, I screwed up. I'm thinking about this. I want to make this change. We will later on in the treatment get to the things that we can do different in the couple and the relationship, but that can't be the first step. So it's not like we won't address it, but if we sit there and thinking, hey, this is all what the hurt person did, we're not building the trust back. So you've got to take your ownership if you're the betrayer at the beginning and say, hey, I messed up. I'm willing to do whatever it takes. And oftentimes that it's building trust. So things that we do for people is like they have to share their phone locations or passwords, or we're doing like looking through emails to show that there's nothing else happening. Because one of the biggest things that we see, and I love this way of looking at it, there's like relational PTSD. There's relational trauma that happens because ultimately your world, your relationship world imploded. Like everything that you thought is changed. So there's hypervigilance. You're not sleeping. Like you can't trust. You are more angry. So we have to like work with the trauma that happens with that other partner. And not that the betrayer doesn't have trauma, but we're working with that other one. So that's why we have to share the phone, share the location, because that works on their hypervigilance as that reassurance. And if it takes them 150 times to look at your phone, then why not? Because at 151 and 152, they don't have to do that. And they feel reassured that you're committed to making this change. So I see that's so positive, and then we can get on an even better trajectory than before.
I think my neck's getting sore from nodding so much as you're talking, because I'm just like, yes, it is, it's betrayal. And so once we call it that and we look at like what other betrayals are happening in this relationship, what other rules were agreed on that are not being followed, like it's not just infidelity, right? Like, and so how do we, say we don't want to do something or not agree to something that we're not comfortable with, right? And so we can have those conversations. But like you said, it's trauma, especially if it's a huge betrayal. And the person who was who did the betrayal actually is the person on the inside. They know what they did. The other
Yeah.
person is left going, is there more? I don't know what happened. Are they really being honest now? What are they? So that's why that need to kind of look through things, and because they're replaying and rewriting all of the history. Like, when did this start and how long? Like, so there is a lot of questions. And I basically tell the person who was involved in the betrayal, like, if you can't handle these questions, like, it's going to be really hard to move forward. Like, we
Mm-hmm.
need to, this person who, needs time to get answers to these questions. And that's just the start of it, right? Like, and they're in the middle of their whole world fell apart and changed. Sometimes they have some awareness and they're not overly surprised, but sometimes if you're blindsided, like, this can rock your world. And this is often when people are, desperately calling for couples therapy.
Mm-hmm.
Right? It's
Can
just
you
like,
get in this week? I've
yeah.
seen like, or do you have an appointment tomorrow? I'm like, I'm sorry. Like, yes, but like, that's typically what we see. And Dave, I love that you brought that up, because one of the things that I do is the person who's been hurt gets to ask any question they want, but I do a caveat. Specifics about sexual details and things like that, I say beware, because that can open up some more levels of trauma and things like that may not be helpful, because they might be like, did you do it on our bed? How many times? Like, that doesn't matter. It's about the betrayal. So I often give them a prompt of a whole bunch of questions and say, like, ask whatever you want. But it is like, how did you feel when you were doing this? Like, did you feel like you were like, how did you feel about getting caught? Like, there's all these sort of questions that you can ask that might be very helpful for you to know. So ask away for that to your partner.
Yeah. And on the flip side, the person who's disclosing this information, sometimes they're feeling guilty and they just want to offload it to help feel less guilty. And that's actually not helpful, at least not, at the pace or at the time that it's being done.
Yeah.
So it's just like, you're like navigating this really challenging kind of conversation. And how do you do it at a pace and that's appropriate, that still has, like you were saying, the safety and the boundaries, right? This is boundaries, right?
Yeah.
I thought we had this boundary and you crossed it. And now where do we go from here?
Dave, you stimulated two thoughts on me with respect to that. Is here's the thing that when I was listening to this Estelle Perel, The State of Affairs book, which I love, recommend it to all couples, is did you talk about your actual boundaries as what is an affair and what isn't? Because so many couples don't. Like, is pornography, for an example, a boundary in your relationship? Like, is that considered a betrayal? Or is it going for supper? Or is it talking to somebody? Or is it sex? Like, so many couples don't have that conversation beforehand. So we don't know how the people respond to if this is a fair or not. Because some people have open marriages and the intimacy and sexual act is okay. But if you're emotionally invested, it's not, or whatever that looks like. So couples need to have that conversation as to what is their boundary, first of all, so we don't make assumptions. Because when I was listening to that, I'm like, I've never had that conversation with my husband about what our boundaries are. Like, I just assumed, and I was like, I'm going to actually ask him, because I just figured this is what it was. So don't assume, I think, is one of the first pieces that I really want to reiterate. And that's something couples need to be aware of. Yeah.
One of the things when you were talking about some of the interventions in terms of like, okay, let's put on your location tracker, let's check your email, really reminds me of exposure therapy. It's like that trauma that both of you talked about that one of the partners may go through. Now it's like, okay, we're going to expose you to, the emails, the messages, like, let's take a look. I can also see sort of the anxiety and nervousness from both sides. Like, it's almost like as you're starting these activities, these tasks, it's both partners may be very weary and really not sure of where this is going to go.
And okay, so great point, Andrew. These things don't have to happen. They're only what the hurt person feels they need to build trust and reassurance. So if they don't feel like they need the location tracker, or if they don't feel they need the passwords, we absolutely don't do it. Like, that's not like a structured or something like that. I follow the lead of what the hurt person needs in order to feel that they're building trust again. But another thing that we'd actually also do, so I follow their lead, but also what we have to work on often is making sure that the affair has ended. Because sometimes what we've seen is like somebody's found out, but we're not sure it's ended. So I need the partner to either like be in the room when they make that phone call, or I've had a lot of them send emails or text messages. That's often the first step. Like, we need to know that this affair is not ongoing. And I've seen couples where the other partner wasn't ready to end the affair. And I'm like, well, it's really hard, actually, almost impossible to proceed in this couple's dynamic if this affair is still happening. So we need that relationship to be over and then take the lead from what the other person needs to build that trust back.
I could keep going down this train, but I also want to just shift gears a little bit, just conscious of time.
Yes.
I think we're all cisgendered, heterosexual.
Good point.
Personally. Yes. And then I'm curious about working with diverse populations, like same sex, or like you were saying, open relationships, poly relationships. There's a lot of different ways that people have relationships, so can you comment on that?
Thank you, Dave, for actually bringing that up, because I also wanted to mention that. And for example, with like non-heterosexual couples, like I don't want to make any assumptions, and like be aware of like, our relationship escalators that we talk about. Like, they have to go from like, you date, you get a dog, you move in together, you do all those things. Like, we don't want to put in those assumptions that that's how that necessarily works or looks. So we are very aware. And I do know, like I said, through the research, that the Gottman method does work with all forms of couples. And so with respect to like same-sex couples and things like that, I do a lot of the same things, because it is all about the relationship. Do they both feel like I'm a fit? I am still interrupting patterns, but I'm being aware with any couple, even like I have couples that are in a different like ethnic or racial background. Like, here's my limitations. Like, I want to work with you. These are the things I know. But for example, I don't know everything about kink culture, because that's been some stuff that's come up. Like, can you inform me what that looks like? Or, in your relationship, what does this look like? So I'm very transparent of like, these are the factors, and I know a lot of the research and I know these things, but if there's an area that I don't know, I'm going to ask you. And is that okay with you, that I don't know everything about your particular culture or your relationship with respect to the same-sex couples? It's up to you. And if I'm not the right fit, then, hey, I'll refer you to somebody that you feel is a better fit too. I don't know if that answers your question, though, hopefully.
It does. Yeah. I think a lot of times, like, I'm telling couples, I don't care what the rules are. Like, you get to decide what the rules are in your relationship, whether those are cultural rules or like rules of, what other relationships are permitted, or like but both of you need to know what the rules are, and both of you need to agree with them, because that's when the betrayal happens, right? And so much of our relationships, I know growing up, I didn't have this information. Like, you fumble your way through relationships and you make a lot of assumptions, and what's okay, what's not okay. And so sometimes couples therapy is just, like you said, you're almost like, well, what are the rules? Like, oh, well, you said you were okay with that when we were dating, but now you're saying you don't like that. Like, what happened there? And a lot of times we try to put on our best foot and try to impress and connect and be attractive to other people. And sometimes that leads us down a path of like, well, now that we're married and I'm comfortable, surprise, there's a lot I haven't shared. And it's like, okay, so now what happens to the relationship? So anyways, I'm going on a soapbox here, but.
And Dave, I completely agree with you, but I also want to know, as like the therapist perspective, is like, my role isn't to judge what you guys do in your relationship. Ultimately, I don't care, in the sense of like, I'm not invested in caring, but like, if you decide that your boundary is, like I said, an open relationship, or you don't even want to have any outside contact with another gender, or we're doing all these other things, it doesn't matter to me what exists as your guys's norm or your comfort level. My job is to help you guys establish that clearly, comfortably, in a way that everybody understands and feels safe and heard. So please know, when you're going to a therapist, like, we truly, truly don't judge like your type of relationship or what you're coming in with. It's We just want to help you get to the place that works for you guys and both of you in that couple.
So Holly, I am wondering, one of the points you brought up earlier, that is an obstacle to couples counseling is when one partner is not ready for change.
Mm-hmm.
And I guess if there's any tidbit that we can throw out there to our listeners, for somebody who is thinking about going to couples counseling,
Mm-hmm.
what can one partner do to bring a sense of comfort to the other partner, to probably in a very safe way, hopefully, to say, hey, you know what, this is what I'm thinking about.
Mm-hmm.
Can we go to couples counseling? What are some things that one partner might be able to do?
Well, one of them I think is have them be able to reach out to the person that they're comfortable with. So I think that's one of them, giving them that control to be able to see who a therapist might be for them and telling them, like, I'm willing to go with you to whoever that is. I think that's one piece, is letting that other partner to decide. And the other one saying, like, if you truly feel like I'm here to improve the relationship, like it's not about I don't love you or I don't feel like I want to be with you. I'm doing this because I actually trying to improve the relationship. I want to feel more connected to you or communicate better. So that's oftentimes people think that they're going because the relationship is failing or they're going to separate. And I really reiterate, and that might be the case that happens later on, and it might not, but just saying our goal is to improve it together, whatever that looks like.
That's awesome. I love that last piece you said. We're here to improve it together.
Mm-hmm.
So one of the things we do, Holly, close to the end of our episodes, we talk about some of the things that we learned from today, or things that we can take away from today. So I'm going to ask Dave, what is something that you can take away from today in our conversation with Holly?
Oh, I'm totally drawing a blank. There's so much going through my head right now. And I'm like, there's so much good stuff. And I wish we could keep talking. But yeah,
Do you want me to go first?
yeah, sure. Go first.
Okay, I'll go first. You know what? I think one of the things that Holly brought up for me that is so important, is safety, and that both partners need to be in it together. If one partner is really checked out already, a thought that comes to my mind, again, working with so many families and parents, is, how is this relationship going to work? Another piece that comes to mind too is so many points that Holly brought up. I actually use in my therapies with children and their parents, whether it's establishing boundaries, whether there's contempt in that relationship. Is one parent really, really tough on a child to the point where it's like a dominating relationship? And sometimes I will get parents like, well, shouldn't it be a dominating relationship? It's like, let's rethink that, right? Let's reframe that. Right? So many points that Holly brought up, I can now bring back to my own practice when it comes to working in any kind of relationship, really, whether it's a parenting relationship or relationship with children.
Yeah, that makes me think of I often even if the couples therapy doesn't help your relationship, the patterns that are established in this relationship likely are going beyond this relationship, right? With your kids, like you're saying, Andrew, or other coworkers, other family members. Like, just you can go to couples therapy and benefit because you can identify kind of the patterns that you tend to have, whether they're attachment or whatever. But in terms of like takeaway from today, I was just sitting back and just letting like whatever comes up for me. And what I got is just this sense of like optimism that I think you bring to the therapy room with the people that you're meeting. It's like, we can do this. There's hope no matter what you've kind of been through. There's a process, there's research, there's a way to improve your relationship. If you're both willing to put in the work, we can do this. And I think you didn't really say that in words, but everything that you've said today just gave me that kind of impression. And I really think that's helpful for anyone who's willing or thinking about embarking on this scary thing.
Honestly, I want to add that you've said the same thing. Is like sometimes it's time is an issue. a barrier can be like, when can we find our scheduling, or we can't do that.
Mm-hmm.
So, or how often can we meet? And so sometimes people can meet on a weekly basis, or sometimes it's like, they have jobs that are conflicting. I'm like, I can't meet it again until 3 months. There's things now called like marathon therapy, and that I offer that too, is like, you can book like a weekend or a few days and you do a whole bunch of therapy condensed in a short amount of time. Or like what I'm starting this year, and actually it's in November, with my colleague who's an emotion focused therapist and me, Gottman. So we've got 2 different therapists. We're doing a retreat weekend. Like, we're going to Kananaskis and we're doing those things in a way so you can actually get a whole bunch of the therapy at one time, which can also be a lot of benefit, rather than like trying to extend it out over a year or 6 months. You can do that like in a condensed time frame and get all that kind of support. So just know that don't let time be a barrier. That's all.
Holly, where can people find that information about the retreat weekend?
It's on our website, actually. It's on the front page, and it's November 7th to 9th of this year. Like I said, we're keeping it to just 6 to 9 couples. We wanted to see how it goes, but it's a way to get a lot of learnings and a lot of practical experience in a short period of time. And then you get to go to like the Nordic spa and like do a lot of other fun things. So it's going to be pretty cool.
Do you have like follow-up sessions, or like are people that go for this retreat are able to kind of stay with you if they do want that kind of longer term? Okay, cool.
So that is why we're also taking only a small amount of couples, because basically you can go on our caseload after that, and you can choose, because Erica is the psychologist who's doing it with me, who's lovely. You can continue on with myself or Erica, and then we get to do that almost maintenance treatment, or like, do some other ones maybe a little bit more in depth. So absolutely, we do continue on if that's what the couple would like to do.
That's amazing. Like, so many different ways of providing therapy. So that's great. Holly, thank you so much for being on our show today. It's been so much fun. Like Dave said before, we could keep going and going with this topic, and we would love to have you back at some point, and we will talk about that further. In the meantime, you can find Dr. Holly Whyte at YEG Psychology in Edmonton, Alberta. Her website is yeg-psychology.com. And again, on Facebook at YEG Psychology, and on Instagram at yeg.psychology. So thank you, Holly, for bringing your wisdom, for introducing couples therapy to our audience. It's been such a joy.
Thank you.
Yeah, thanks, Holly. We do have to do a plug because we have not been doing this. So if you like the podcast, click subscribe or whatever buttons, likes, or things. We're still new to this. So yeah. And just want to throw that out there. And yes, Holly, even though we went to grad school together, even though we've maintained some contact, I just learned a whole lot more about how you practice and how you are helping couples. So just really appreciate this today. Thanks.
Thank you for having me.
Take good care, everyone.
Yes.